Hey guys, just wanted to pop down for a quick chat just regarding a couple of injuries I've had come through the clinic lately. So I've had a few sort of higher grade ankle sprain injuries. So I've had a relatively sort of bigger age range, so I've had sort of people in their 40s, in their 20s and into their teens having these injuries. And one of the common questions that I've been asked lately is, do I need a surgical consult for this injury? So more often than not, what we're looking at with these injuries is, in most cases, an isolated ATFL sprain. So that's the most common ligament that gets injured in the ankle during one of these injuries. Usually it occurs when you're sort of slightly up on the foot and you sort of roll over the top to the side. The CFL, which is one of the other ligaments in the ankle that can occasionally get injured, is usually more so when the foot just rolls straight out to the side. Occasionally they can be injured together. I wouldn't say it'd be hugely uncommon by any means. Most of the ones we've had lately are just isolated ATFL injuries. So we've had one ruptured ATFL, one higher grade ATFL injury, which the sonographer who does the ultrasound queried whether an MRI may have potentially been needed to further assess whether there was a full rupture or whether it was just a higher grade ATFL sprain. We've had another one which was an avulsion, where the ligament is essentially away from the bone rather than the ligament itself being torn or ruptured. And then we've had sort of a few higher grade 2 injuries. So most of the discussion, I guess, with these cases where it is an isolated ATFL sprain is, what is their functional stability like? So more often than not, I would say these cases are able to return to sport without any real longer-term issues. They may potentially require the use of ongoing taping or bracing, and that could be either from a confidence perspective, an injury and risk management perspective, or purely just they like the feeling of having that security around the ankle, that compression and that stiffness and tightness that the tape or brace can provide. So yeah, most of the discussion, I guess, will revolve around what are their goals to get back to, what level do they want to play. So, some people may say, look, I'm happy to give away sport if it means I can get away without surgery, which in most cases people are going to be able to do that without any real issues. It's most those people who are wanting to return to sports such as soccer, AFL, netball, basketball, where you have those short, sharp, stopping, cutting motions. You have other people on the court with you. Netball and basketball in particular, you have the jumping and the landing component. You have a lot of things, I guess, to take into consideration. And I guess that's where a physiotherapist with experience in sports will really want to sort of delve into how do you play the sport, what position do you play, what are the demands you're actually going to put on this ankle in the future, and what does that mean for your potential options going forwards. And this isn't to say that a surgical option is a bad choice. I guess at the end of the day, for me, it's about people making a decision about their healthcare that is informed. They get all the information, and they can weigh up the pros and cons of both pathways. It's neither my role nor a GP's nor a surgeon's place to decide what pathway someone should choose for their own healthcare. So most of the cases we've had have all gone non-surgical. We've got one surgical client coming through at the moment who's just about to return to some running drills. And they are all progressing quite well and quite smoothly. So I guess sort of our old one who's suffered a higher grade 2 injury, the sonographer queried, do we go for an MRI? I guess one of his big questions is, and this is something that he had a lot of people ask him and tell him, was, you'll need surgery for that. And that was, I guess, a discussion we had about what did he want to return to, what did he want to get back to. And so his goals were to still be able to live an active lifestyle, cricket umpiring, which still requires a lot of change of direction and fast-paced movement. While I wasn't under that perception, I learned that about cricket umpiring. And we've been able to progress through his rehab. We're looking to get into those high-level plyometric things and probably be looking to get back into maybe a little bit of running over the next few weeks and looking to introduce some change of direction work. But he has really progressed quite well, and he did mention to me the other day that he was a little bit surprised at how quickly and how well he had recovered to this point, given where his perception of his injury was, in that he felt that he was likely on the pathway towards a potential surgical option and surgical consult, and it's great that we've been able to avoid that from that perspective of being able to rehab him and get him back to doing most of the things that he wants to be able to do. I think for a little bit more time he's going to get back to that. Probably the cases where maybe a surgical consult would be handy would be, I guess, if you're looking at a combined higher grade injury where you've got both the ATFL and the CFL. Either one is ruptured or both are ruptured, or you're looking at both quite high grade injuries where I guess that sort of passive stability component of that outside of the ankle is maybe not quite as sound as it should be. That would be maybe some of the few cases that I would look at. I guess in terms of other ankle injuries, the other one you're probably looking at is what's called a high ankle sprain. Pain location and pain or injury mechanism are usually a little bit different to a typical lateral ankle sprain, but they can be important ones to keep an eye out for, to make sure that sort of ankle dome sitting over the top isn't unstable moving forwards. And usually that would be an X-ray component, looking at a standing X-ray to assess that joint to make sure that it's not unstable and that it's not gapping and opening up too much. But hopefully that gives you guys a little bit of an idea of the potential that you can have for these higher grade ankle injuries. It doesn't mean if you have a ruptured ATFL that you need surgery to rehab it. There's plenty of examples out there of probably professional sports people around the world and just everyday people who have been able to rehab, return to sport and do everything they wanted with an isolated rupture of the ATFL. So any questions, any comments, drop them below. Otherwise, have a great week.